The Innovation Hub, the innovation agency of the Gauteng province, is a wholly owned subsidiary of the Gauteng Growth and Development Agency. It was established by the Gauteng provincial government through its Department of Economic Development to promote Gauteng's economic development and competitiveness by fostering innovation and entrepreneurship. 15 million HIV tests, 224 clinical trials, one integrated platform. Aurum runs Africa's largest infectious disease trial network. Funders pay for access to 67,565 plus participants across HIV, TB, COVID-19 and antimicrobial resistance studies.
Aurum has a large footprint, a national footprint in South Africa, as well as a presence in Ghana, Mozambique and offices in the US. I am Trevor Beattie, the Technical Director of the Clinical Research Division of the Aurum Institute. So we are sitting at the Aurum Institute's Tembisa Clinical Research Site. This is one of 5 clinical research sites within our Clinical Research Division at the Aurum Institute. We boast a biosafety level 3 negative pressure laboratory that allows us to handle infectious pathogens and work on the diagnostic and testing thereof. We also have a large biorepository where we can store samples long term. And we also boast an inpatient facility at our Pretoria clinical research sites.
The larger division employs 1,300 people, delivering technical support to South Africa's public healthcare system under direct government contracts. Operations span South Africa, Mozambique, Ghana, Lesotho and Eswatini. The model is infrastructure light and regulatory approved in multiple jurisdictions. A decade of IT investment created proprietary health data systems now being commercialized for other African markets. The same integrated model trials plus delivery aligns with BRICS health priorities: TB, HIV, pandemic preparedness, and antimicrobial resistance.
So Lenacapavir is a twice yearly long-acting injectable HIV drug. It prevents HIV. It is highly effective when compared to standard oral HIV preventative regimens. It is safe and well tolerated. Lenacapavir is recommended in populations that are at risk of HIV infection. These are adolescent girls and young women and men that have sex with men and transgender individuals. Additionally, Aurum was a key participant in the Ensemble 2 and Ensemble 3 large clinical trials that evaluated Janssen's COVID vaccine. This led to licensure and rollout within South Africa, where South Africa then participated in a phase 4 trial where healthcare workers were vaccinated. Aurum stored the vaccine, prepared the vaccine, transported the vaccine, and also vaccinated healthcare workers working at the face of the pandemic. We have also done many small and large TB vaccine trials.
Diversified funder base, multiple year government contracts, and infrastructure light operations reduce concentration risk.
What is exciting in the industry is that there is a lot of talk and activity around Lenacapavir manufacturing and equitable access. So this is not just access in high-income countries, this is manufacturing and access to populations in low to middle-income countries, the individuals that require the intervention. We also anticipate a new TB vaccine to be licensed within the next few years, and similar discussions are already on the go around manufacturing and equitable access of TB vaccines. What is really important to me is that finally we are seeing that there is a movement to include pregnant and lactating women in research. They've predominantly been excluded from research. So the work that we do directly impacts communities by the data that we generate that transforms policy, that changes guidelines and essentially makes new treatments available to the populations that need it. Further to that, Aurum takes policy and implements it and puts it into practice and provides assistance to the healthcare sector. So Aurum on its own has conducted more than 13 million HIV tests. We've screened more than 1.5 million people for TB. We've treated over 180,000 cases of TB. And we were pivotal in the rollout and vaccination of healthcare workers.
Aurum seeks strategic partners, not donors. Co-investment opportunities exist in Brazil, India, and Russia health infrastructure.